Hello, I'm Alberto Riñon, and here at Merck Serono we are committed to improving the lives of patients with multiple sclerosis. I'm the lead author on this paper and would like to explain to you the rationale for commissioning this research, summarize our key findings, and consider what the results could mean for the day-to-day management of patients with MS. Most patients are diagnosed with a relapsing remitting form of MS, but eventually most will develop a progressive form of the disease. Despite much research and important advances in recent years, MS remains incurable and patients face many years of treatment aimed at preventing relapses and delaying disability progression. As with all chronic conditions, helping patients to maintain a good level of treatment adherence is very challenging, even though evidence shows that poor adherence can compromise treatment success. In MS, first-line therapies are usually administered by injection, and common sense tells us that issues such as needle phobia, treatment fatigue, and forgetfulness might contribute to poor adherence. But in reality, little is known about the factors that really influence patients' behavior on a daily basis. Because of this, we commissioned the MS Choices Survey to investigate both physician and patient perspectives on living with and managing MS around the world. 331 patients and 280 physicians from 7 countries took part in the survey. Physicians and patients completed a questionnaire of around 30 questions. Different questionnaires were tailored to each group, and we looked at patient involvement in treatment decisions, timing of treatment initiation, and treatment interruptions and discontinuations. Interestingly, we found differences between the responses given by patients and physicians, especially on the issue of treatment adherence. For example, 31% of patients reported taking a break from their treatment, but the physicians believed that only 17% of their patients took a break. When we asked about the reasons why patients were not taking their treatment, physicians considered side effects to be the main reason for more than 80% of the patients. But in fact, only 42% of patients said that. A considerable proportion of patients said they missed injections because they felt drained or fed up with their treatment or because of practical issues related to taking the drug. There are of course limitations to performing a survey such as this, and these are discussed in detail in our publication. Notably, the patients and physicians did not necessarily come from the same centers. But what could these results mean in real terms for patients with MS and their physicians? Most importantly, physicians could be underestimating the scale of poor adherence, so that they may think that a treatment isn't working when in fact the patient just hasn't been taking it. This might lead them to switch the patient to a more aggressive treatment rather than openly discussing adherence to the current treatment with their patients. There could be ways to address these problems. In general, the differences that we found between patients' and physicians' opinions suggest that communication could be improved between healthcare professionals and patients in order for them to work together to achieve the best possible clinical outcomes. Our paper explains more about the methodology and results of this survey, including geographical differences that we found for issues like the level of patient involvement in their treatment decisions. I hope you'll find it interesting. Thank you for your time.